I asked my long-term OBGYN for a referral to someone who specialized in fertility issues. I wasn't getting pregnant and was curious just simply to inquire about why and to see if there was just something that, something simple that we could do. So my long-term doctor referred me from South Jersey up to Dr. Goschel. Said, if you really want to know what the problem is, if you're not wanting to delay that at all, you got to go see the man. I was feeling just curious. I kind of had it like it was any other medical appointment that I was going to. If I was having a foot issue or an eyesight issue or something, I was just curious what was happening in my body and why I wasn't getting pregnant. Thinking it was going to be a real simple thing to tweak or improve upon. So curious more so than anything. That as we quickly got up and running and had appointments to come to, since I lived about an hour and a half away. It was a bit of a commitment. That was a concern for me, was I going to be able to make this commitment and keep this commitment? But the staff here really helped me with that. They were awesome. So very flexible, and I remained flexible also. After each appointment, which sometimes was every other day during the course of a month, I'd come in the morning, and I'd have my appointment. They'd draw blood, and I'd get some instruction on carrying on until the next appointment a day or two later. But usually that afternoon, I'd get a phone call from one of the nurses, and they would give me some instruction based on my results from the blood work that day. Everything was really timely and very very well coordinated. Blood was drawn in the morning. I got the phone call in the afternoon. Here's what your results were for this hormone level, that hormone level, and this one. Here's what that trend indicates based on the last appointment 2 days ago or a little longer. And so for that reason, we want you to take this medicine tonight and in this quantity. Then as we got further along in the process, of course, it gets a bit more intense, but it was always very specific instruction based on specific results from my most recent exams. The outcome was I now have a beautiful son who's almost 5 months old, and he's wonderful. He's amazing. If you have a curiosity for why your body is not responding as you would expect it would, at least go to RMA and get a consultation. Find out what your options are, and then make the decisions that work for you and for the medical professionals that are there to guide you.